Anal cancer is considerably uncommon in the overall population, but is considerably high in people living with HIV, and even higher in men who have sex with men. Anal squamous cell carcinoma is mainly caused by infection with high-risk human papillomavirus and is preceded by high-risk squamous intraepithelial lesions. HIV-related immunosuppression represents another risk factor for the development of anal cancer. With the arrival and increasing use of HAARD, life expectancy increased, resulting in a shift of the causes. In this context, non-AIDS defining cancers have gained importance, and among them, cancer of the anus. This study aimed to determine the incidence rates of anal SSC and the efficacy of a screening program. It was a retrospective analysis from a prospective cohort of people living with HIV that were attended on a regular basis on the outpatient HIV clinic of the University Hospital Virgen del Rocío in Seville. In 2010, a specialized program for screening and treating anal cancer was established for MSM within the Seville cohort of people living with HIV at risk for anal cancer. From 2004 to 2017, a total of 3,878 patients were followed in the clinic and were eligible for the present study. The median age at the moment of inclusion was 38 years, 40% were MSM, and 17% were female. In 13 years, a total of 20 cases of anal SCC were diagnosed. 55% were MSM and the remaining were heterosexual injecting drug males. 4 of 20 were diagnosed within the scan group. The overall incidence rate was 63.9 with a change in the incidence rate over time. The same happened in the subgroup of MSM with an incidence rate of 103.6. From 2010 to 2017, incidence rate within the scan group and the MSM of the follow-up group were 95 and 201 with a p-value below 0.001. The incidence rate of anal SCC in people living with HIV increased significantly throughout the study periods, both in the overall population as well as in the MSM subpopulation. Immune reconstitution and the clinical stage of the HIV infection showed the strongest impact of anal SCC. Participation in the SCAN program significantly reduced the incidence of anal SCC in MSM. So strategies on diagnosis and treatment could result in a decline of anal SCC when adherence to the screening program is adequate.